All right, guys, so we're back. We're going to talk about some lower body soft tissue care today. So we had upper body in another video, and I think the lower body is probably even more important for gymnasts to do just because of how much demand they have on their legs. So think about it's a jumping and running sport as it is, but also think about you squeeze your legs together, you keep your knees straight, and you point your toes for about 4 to 6 hours a day. Right? It's going to get very, very stiff over time. And the problem is that the more that you get stiff in those areas, one, you may lose your flexibility for jumps and for leaps and for skills, right? But also you may have problems landing. You might get stiff ankles, you can't squat the right way. A lot of heel pain comes from that and knee pain, but also people who have a lot of stiffness in the upper hip area, right, might get a very overarched pelvis and their back might start to hurt, or it might affect the way that they can get into a hollow shape for skills. So managing the soft tissue is very important because a lot of gymnasts are lax in their ligaments. If they get stiff in their soft tissue, they start to get, a little bit of irritation of their joints. So the first thing we're going to start with is just bottom of the foot. We're going to go kind of starting on the plantar fascia area. What we're looking for is just a moderate intensity, so maybe 4 out of 10 discomfort. It shouldn't really hurt that bad. And we're probably going to go about 30 to 60 seconds per muscle group, or about 10 passes up and down. That's kind of been summarized by a lot of research to kind of be like what we think is the optimal dose, depending on kind of where you look. So after we go on our foot, we're going to go on a foam roller, and we're going to go on the back of our calves. So we're going to go from kind of the middle of our Achilles all the way up to the back of our knee. Again, 30 seconds. And the other thing that can help is you can move your ankles up and down nice and slow. These are typically really uncomfortable, and a lot of gymnasts, especially if they haven't done this every day, because of how overworked the soft tissue gets. So just be careful when you're first starting out. You really don't want to go too hard. So moving up from there, we'll go back of our legs. We're going to go hamstrings now. So we're going to go back to the knees all the way up to the hips, and same kind of thing. You can kind of lean towards one side or the other. You can do both together. Whatever makes it feel moderately, comfortable is kind of what we're going for. Foam rolling is really all about consistency over intensity and it being part of a bigger program. So foam rolling plus stretching and all the other stuff we'll talk about on the videos is good, but you want to make sure it's just done 5 to 10 minutes every day. So after this, we'll flip over and we'll go the front of our legs and our quads, which is probably one of the more important ones to get. So we're going to go kind of from the kneecap all the way up to the hip. Right, so we're going to walk all the way down. And again, this one's going to be something that's for gymnasts. You squeeze your legs all day long, right? If you've never done this before, it's going to be really uncomfortable. So go very, very easy. You can see she's up in a plank. She's taking off some of the pressure, right? So we're going to go here. And then the last one we're going to do on the upper leg is the inside of the leg. So we're going to kind of sit on one side, kind of bring the foam roller down a little bit and kind of face the camera. Yeah, and we're going to go on the inside of this leg. Yep, so we're going to go from the knee all the way up this way, right? Again, squeeze your legs together for a long time, right? It can be very, very easy to get stiffness on the inside of your thigh here, right? You can lose your straddle split, but also a lot of people will have an overarch in their pelvis. And then lastly, we're going to sit on top of the foam roller, and we're going to just do the outside of our hip. So sitting up kind of here, right? Outside of your hip, outside of your knee area, right? Can also become a little irritated the more you do jumps and leaps and things of that nature. So what we're looking for, again, 30 to 60 seconds, right? We're not going to go crazy, but just consistently doing this every single day.